Bismillahirrahmanirrahim. Assalamu alaikum. Today I'm going to tell you about that what is actually the difference in an ICU and a ward. The major difference between an ICU and the ward is that we get monitors bed to bed in the ICU so that every vital of the patient is monitored closely. So that's why it is known as the intensive care that is provided to the patient in terms of vitals monitoring and also in terms of the nursing care. There are three categories of patients in the ICU. At the two ends, we have two extremes of patient. The one patient at one end is the one who is not critical, but we are admitting that patient into the ICU because we predict that the coming hours or the coming days can have a deleterious effect on the patient, and we want to monitor him or her closely so that the patient is not deteriorated or become critical. And this is merely the critical observation, admitted for the critical observation purpose. At the other end of this category, we have those critical patients. Those are very critical, but we know that despite putting our all our efforts, we are not going to get the fruitful results, and our all the efforts will go in vain. While in between these two ends lie the category of the patient who are critical, and if we put our efforts in those patients, we are going to reduce the mortality and morbidity in that patient, and these patients should be recognized on the daily basis and they should be given utmost importance. What should I do while entering ICU, moving from bed to bed in ICU, and leaving in ICU? The answer is hand sanitization, hand washing, and hand cleaning. So, in short, all this mean that I need to clean my hands before I touch any patient in the ICU so that I'm not infecting the patient with the bugs which are present on my hands. And the second important thing is when I move from one bed to another, I do re-sanitize my hand or re-wash my hands or at least change the gloves that I'm wearing so that I'm not the person who is transmitting bugs from one patient to the another. And it is very unethical to conduct the whole of the round by wearing just one pair of the gloves. In that case, we are only protecting ourselves from the bugs of the ICU, but in simple ways, we are actually making ourselves the mode of transmission of the bugs from one patient to another. So it is a very important point to be mentioning to be is a very important point to worth mention over here, that we need to sanitize our hands every time we enter the ICU or we touch any patient, any new patient, and also when I'm leaving the ICU. Two mnemonics have evolved over the years regarding crucial ICU interventions. By using these mnemonics, you can reduce errors of omission and increase compliance with evidence based practices which improve outcomes in ICU patients. Try implementing these mnemonics the next time you are pre rounding and rounding to ensure that these crucial interventions are not forgotten. The two important mnemonics are fast hugs BID, and the second one is maidens. Fast Hugs BID also includes PME, which I'll explain. In the Fast Hugs BID, F stands for feeding and fluids. We have to initiate the enteral feeding preferred over TPN as soon as possible, and we have to address continued need for fluids every day to prevent the overload. Analgesia pain should be assessed regularly using validated scales such as CPOT or BPS. CPOT stands for Critical Care Pain Observation Tool and BPS for Behavioral Pain Scale. S stands for sedation. Sedation should be assessed regularly using validated scales such as the RAS or SAS. RAS stands for Richmond Agitation Sedation Scale and SAS for Sedation Agitation Scale. T is for thromboprophylaxis. We have to consider VTE and bleeding risk and initiate the appropriate prophylaxis, pharmacological versus mechanical. H stands for HOB elevation, head of bed elevation. Elevate the head above the bed 30 degrees to reduce the occurrence of GI reflux and pneumonia. Reposition patients periodically throughout the day. U stands for the ulcer prophylaxis. We have to initiate stress ulcer prophylaxis when patients have one major risk factor or two minor risk factors present. G is for the glycemic control. We have to maintain blood glucose at 140 to 180 mg per deciliter per SCCM/ASPEN guidelines. SCCM stands for Society of Critical Care Medicine and ASPEN for American Society for Parenteral and Enteral Nutrition. S is for SAT and SBT. SAT is a spontaneous awakening trial and SBT for spontaneous breathing trial. Opioids or sedative tapering and timely removal of mechanical ventilation play pivotal roles in liberating patients from the ICU. SAT, colloquially known as sedation vacation, should be performed daily, and SBTs should be paired with SATs in eligible patients. B is for the bowel regime. Patients should have a bowel regime ordered, especially those on opioids, to prevent constipation. I is for indwelling catheters. Central lines, arterial lines, urinary catheters, and other invasive lines should be discussed daily on rounds and discontinued when no longer required. D is for de-escalation of antibiotics and delirium. Antibiotics should be de-escalated appropriately based on culture data, and stop dates should be implemented as soon as possible. Delirium should be assessed regularly using validated scales such as CAM-ICU or ICD-SC. CAM-ICU stands for Confusion Assessment Method for the ICU, and ICD-SC stands for Intensive Care Delirium Screening Checklist. In the last, I would like to add that we have three more alphabets. These are PME. P stands for the daily assessment of the pressure source in the bedridden patients, and M stands for the daily morning care in the form of the hair wash, daily bath, and cleaning of the mouth by using the chlorhexidine mouthwash, and both ends of the GIT should be kept clean. E stands for the general eye care. This Maiden's mnemonic is actually for the medications that we have entered, so we need to review the medications daily. So M stands for medication reconciliation, A is for antimicrobials, I is for indication for the medications, D is for the drug dosing, E is for the electrolytes, hematology and labs, and N stands for no drug interactions, allergies, duplications, adverse effects, and S stands for the stop dates that should be mentioned whenever we are entering any medicine in the patient's file. Thank you.